My name is Catherine Bowman. I was the Executive Director of the Association of Allied Health Professionals Ontario. At the time of the merger, I was the first president and was on the founding committee as well. So I have a long history with the association. The association exclusively represented healthcare professionals, so allied healthcare professionals, or what we call paramedical employees. We were a rather small independent union, and Mike Harris had it in for small independent unions. And so we were in the fight of our lives, really. There were a lot of mergers going on, hospital mergers, and we decided that we needed more resources and to join forces. We went to the nurses union, we went to SEIU, and we more or less interviewed them and tried to see where the best fit was, and decided that OPSEU was the best fit. I was involved in the negotiations with OPSEU. So we didn't just merge, we negotiated a merger. So we negotiated with the union how we were going to bring the members in, how we were going to bring the staff in, what was going to happen as far as the transition to make it as smooth as possible for everybody involved. OPSEU knew allied health professionals the best, and that's really what made them the best fit. We were bumping into OPSEU everywhere. In some of the hospitals where we had bargaining units, OPSEU also had bargaining units, and the other unions really didn't understand the needs of health professionals. So for instance, when we talked to ONA, they're very nurse-centric, and we needed to be in a union in a home that understood allied health professionals and where they had a voice, and they had a strong voice in terms of their representation, and so they could speak on their own behalf. Coming into OPSEU, there are specialists. So there's a grievance department, there's health and safety specialists. They also gained access to the central bargaining process. So we were bargaining with individual hospitals, and by coming into OPSEU, our members were able to retain. It took a few years for us to be able to negotiate this with the OHA, but they were able to retain some of their superior provisions that they had in their collective agreements, and yet join the central bargaining process. And OPSEU sets a standard for allied health professionals in the province. We saw a great growth in terms of our representation of healthcare professionals over the years. When we first came in, I believe we were maybe 8,000 strong, and we're now well over 30,000. So it has definitely benefited everybody. But the important thing is the protections in the collective agreement. And you need a strong voice at not only at the table, but in between bargaining. You need somebody who's going to fight for you with your employer, who's going to be able to train people to be able to take on the employer, to speak with some authority, who isn't afraid to speak up. Everybody thinks of doctors and nurses in a healthcare setting, and the allied health professionals sometimes are the invisible professionals that nobody sees. They're critically important from a diagnostic perspective as well as from a treatment perspective, and so they need their own voice. So it is critically important to have that background and understanding. We've been involved since the early 70s as far as the paramedical and allied health professionals are concerned. So we're in it for the long haul, and I think more than ever, we need a union that understands and speaks for the allied health professionals. We need somebody who can stand up to the Ontario Hospital Association, who's a strong voice, who can talk about public policy, is a strong voice in the community as well. So I think OPSEU is recognized and has been recognized for years as a voice for professionals. I think OPSEU is the union of choice because they really, truly understand allied health professionals.